relationships of trust in Indian countries. And I'm a lawyer. I mean, I don't build relationships of trust. Unless it's my client, then they trust me, hopefully. But as I was thinking about this topic, the main issue, or the main point in this topic, goes right along with this conference. It's having a vision. Having someone who will see into the future, see what they want in the end, and having that vision. That's why you build partnerships. That's why you build relationships of trust. Because here in Indian country, anybody who's ever been out there, the issue always is money, resources, know-how. Most tribes, especially the smaller tribes, don't have the kind of money that the bigger tribes have. Don't have the resources that the other tribes have. Don't have the know-how. They can't go out and hire the people that they need to bring in to build these partnerships. Because there's a lot of things out there. A lot of people that want to partner up with Indian tribes, that want to help Indian tribes. I meet people all the time when I go to these conferences. Big companies, small companies, non-Indians, Indians, that want to help Indians, but most of the time, they don't know how. Or if they do know how, there's not enough resources there. And as I was thinking about this, honestly, I thought of Brandi Sweet here because she has done this before.
Michelle Obama came to us and to me and asked if I could help her to develop an initiative called Let's Move. Let's Move in Indian Country is what we ended up calling it. And it was the First Lady's initiative to combat childhood obesity within a generation. The First Lady came to us because she said the White House did this big report and they did this huge investigation on Indian country, and they found that Native American children were experiencing obesity at rates triple, double that of their non-Native counterparts, and that they were experiencing health-related illnesses that were just off the charts. And so, as the federal government, we'll just back it up a little bit, the federal government has a trust responsibility. A trust responsibility to honor and protect the resources. And the greatest resource that we have in Indian country is our children. And so when Michelle Obama came to us, she was trying to uphold that trust responsibility and to do some really amazing, great work to try to improve the lives and the conditions of the children in Indian nations. Very quickly on, I realized that there was no way that I could do all of this by myself. And so what we began doing is we started reaching out to our federal counterparts that at HHS, Indian Health Service, the CDC, the USDA, all of those key federal agencies that are doing work in Indian country in the area of health and wellness. And the first thing we did was we seeded a national workforce. The second thing that we did is we began to do outreach with tribal communities. We held numerous dialogue sessions, and we did a big, huge needs assessment. We surveyed all 183 schools and 122 non-Native public schools that were serving high populations of Native students, along with nonprofit organizations, other types of government entities at multiple levels, and began to obtain feedback on what we were going to focus on for our initiative. We wanted the initiative that we were working on to come from the community. We knew that if it was a top-down approach, it was never going to work. So some of our key partnerships that we were able to forge were, we worked with Nike N7. They gave us N7 ambassadors, athletes like Sam Bradford, Tani Robinson and Alina Begay to help us be the face of the initiative and to do outreach and to spread positive messages. We worked with the Ad Council to develop ads that were targeted for Indian country when we played at key times on the radio in different Native communities. We worked with the Alliance for a Healthier Generation and were able to provide on-site technical assistance and virtual technical assistance to every single tribal school in the nation to help them build local wellness policies and community wellness councils to begin to address local changes in the school. There are really 4 key things that I learned while I was moving forward with this work. And the first one is that you have to have a vision. You have to envision where you're going. And it has to be a collective vision. You have to know what that is. And our vision was combat obesity, childhood obesity within a generation. The second piece of it is by overcoming obstacles. And what I was talking about was our resource development. We didn't have any money at all. Is this. You don't have to have money to do everything. You don't have to know how to do everything. What I learned is that there's somebody out there and they're really good at doing what they do. So why recreate it? The purpose of developing a partnership is to simply marry those 2 things, what you're doing and what they're doing, to maximize and leverage the output. The 4th key point is the permanency of what you're doing. And partnerships, there's different types. There's formal and there's informal partnerships. But to build permanency in a partnership, it really does take a formal approach. And that can be through memorandums of understanding, MOAs, cooperative agreements, joint use agreements, just different types of agreements that can be written to lay out roles, responsibilities, authorities, reporting requirements, and that sort of thing. We launched Let's Live in Indian Country, and the Menominee Indian tribe of Wisconsin offered to be the host. And it was probably it was a life-changing experience for me. When the whole entire community got together. They had a superstar. It was a member of their tribal government that worked with us to plan this event and how it would roll out. But everything on the ground happened by the tribe. And the whole entire community was out there waiting for us when we pulled up in our car. The chairman greeted us. They had the council there. They had all of their admin staff. And they had every single program from the community that did work with kids was there supporting it. The Head Start, the food and nutrition program, the child care program, the Boys and Girls Club. Everyone was there waiting, and it was absolutely amazing, and they set up everything. And so that event went really, really well. And after that, Let's Move in Indian Country went live. The tribe passed a resolution. This tribe was actually absolutely amazing. They passed a tribal resolution making community-wide commitments in support of Let's Move. And they just opened up a grocery store in their community. They were considered a food desert. And I don't know if you know what a food desert is. It means that people didn't have access to healthy food. They had to go miles and miles and miles to get fresh fruits and vegetables. So they opened up a community grocery store. They developed this community-wide partnership. They continued with their Paula activities. They were just an inspiration.
Because Indian country, we can say all day that there's no resources. We can say all day that the federal government has broken treaties. We can say all day that the United States Supreme Court has declared states the worst enemies of Indian tribes. We can say all these things all day, but when it comes down to it, especially for our Indian children, who Congress has said that that's the most valuable resource to Indian tribes, we need to develop partnerships. We need to work with the states. We need to work with the federal government. We need to work with companies who, like Brandi said, There are a lot of people who do a lot of things well. We just need to go out there and ask. Because every week for the tribes that I work for, you have people going out onto the reservation, and there's an automatic distrust because they're always there. What do you want? Non-Indian comes in, tries to do something, it's like, what do you want? So it goes both ways. Tribes, we need to start trusting people who want to help, but also the people who come in and want to help have to be able to understand that automatically by stepping foot on the reservation, you're not going to be trusted. But we can do this through partnerships, through creating relationships of trust. Just wanted to let everybody know that it all starts with a vision. Someone who says, in the end, we want to fight childhood obesity or diabetes, and make things better in Indian country.